breast cancer remains a global health concern, affecting millions of women worldwide. In recent years, significant advancements have been made in the field of breast cancer treatment, including the development of targeted therapies that aim to disrupt the growth and spread of cancer cells. Hormonal therapies, such as Arimidex and Femara, have emerged as powerful weapons in this battle, effectively blocking the production of estrogen and reducing its impact on cancer cells. However, when it comes to choosing between Arimidex and Femara, patients and healthcare providers often find themselves facing a difficult decision. In this video, we will explore the similarities and differences between these two medications, shedding light on their efficacy, side effects, and potential benefits for breast cancer patients. Role of hormonal therapy in breast cancer treatment. Before delving into the specifics of Arimidex and Femara, it is important to understand the role of hormonal therapy in breast cancer treatment. Hormonal therapies are commonly used in cases where breast cancer is hormone receptor positive, meaning that the cancer cells have receptors that bind to estrogen or progesterone. By targeting these receptors, hormonal therapies aim to inhibit the growth and spread of cancer cells. Aromatase inhibitors, such as Arimidex and Femara, are a type of hormonal therapy that specifically target the enzyme aromatase, which is responsible for converting androgens into estrogen. By blocking the action of aromatase, these medications effectively reduce the production of estrogen in the body. Overview of Arimidex and Femara. Arimidex and Femara both belong to the class of drugs known as aromatase inhibitors, but they have slight differences in their chemical makeup and mode of action. Arimidex, also known by its generic name anastrozole, was approved by the U.S. Food and Drug Administration (FDA) in 1995 for the treatment of postmenopausal women with hormone receptor-positive breast cancer. Femara, on the other hand, known by its generic name letrozole, received FDA approval in 1997 for the same indication. These medications are typically prescribed as adjuvant therapy, meaning they are used after primary treatment, such as surgery or radiation, to reduce the risk of cancer recurrence. Mechanism of action of Arimidex. Arimidex works by irreversibly binding to the active site of the aromatase enzyme, preventing it from converting androgens into estrogen. By inhibiting estrogen production, Arimidex effectively starves hormone receptor-positive breast cancer cells, slowing down their growth and reducing the risk of cancer recurrence. Unlike other hormonal therapies, such as tamoxifen, which block estrogen receptors, Arimidex directly targets the production of estrogen, offering a more potent and targeted approach to treatment. Mechanism of action of Femara. Similar to Arimidex, Femara also acts as an aromatase inhibitor, but it has a slightly different chemical structure. Femara binds reversibly to the aromatase enzyme, forming a complex that is less stable than the one formed by Arimidex. However, this reversible binding does not compromise the efficacy of Femara, as it still effectively inhibits the conversion of androgens into estrogen. The reversible binding of Femara allows for a faster recovery of aromatase activity once the medication is discontinued, which may be advantageous in certain clinical scenarios. Efficacy of Arimidex in breast cancer treatment. Numerous clinical trials have evaluated the efficacy of Arimidex in breast cancer treatment, particularly in the adjuvant setting. One landmark study, known as the Arimidex, tamoxifen, alone or in combination, ATAC, trial, compared the efficacy of Arimidex versus tamoxifen in postmenopausal women with hormone receptor-positive breast cancer. The results of the trial showed that Arimidex significantly reduced the risk of cancer recurrence compared to tamoxifen. Additionally, Arimidex was associated with a lower incidence of uterine cancer and blood clots compared to tamoxifen. These findings have solidified Arimidex as a preferred choice in the adjuvant treatment of hormone receptor-positive breast cancer. Efficacy of Femara in breast cancer treatment. Similarly, multiple clinical trials have demonstrated the efficacy of Femara in breast cancer treatment. The Breast International Group, BIG 198 trial compared the efficacy of Femara versus tamoxifen as adjuvant therapy in postmenopausal women with hormone receptor-positive breast cancer. The study found that Femara significantly reduced the risk of cancer recurrence compared to tamoxifen. Furthermore, Femara was associated with a lower incidence of cardiovascular events and endometrial cancer compared to tamoxifen. These findings highlight the effectiveness of Femara as a valuable treatment option for hormone receptor-positive breast cancer. Side effects and safety profile of Arimidex. Like any medication, Arimidex is associated with potential side effects. The most common side effects of Arimidex include joint pain, hot flashes, fatigue, and bone thinning. Additionally, some patients may experience an increased risk of osteoporosis and fractures due to the reduction of estrogen levels. However, it is important to note that these side effects are generally manageable and reversible. Regular monitoring and appropriate management strategies, such as calcium and vitamin D supplementation, can help mitigate these potential risks. Side effects and safety profile of Femara. Similarly, Femara is associated with certain side effects, although they may vary in frequency and severity compared to Arimidex. Common side effects of Femara include hot flashes, joint pain, fatigue, and osteoporosis. Additionally, some studies have reported a slightly increased risk of cardiovascular events with Femara compared to tamoxifen. However, it is worth noting that the absolute risk remains low, and the benefits of Femara in reducing the risk of cancer recurrence generally outweigh the potential risks. Choosing between Arimidex and Femara for breast cancer treatment. When it comes to choosing between Arimidex and Femara for breast cancer treatment, several factors need to be considered. These include the patient's individual characteristics, such as age, menopausal status, and overall health, as well as the specific characteristics of the tumor, such as its size, stage, and hormone receptor status. Additionally, the patient's tolerance to potential side effects and their personal preferences should also be taken into account. In conclusion, Arimidex and Femara are both effective options in the treatment of hormone receptor-positive breast cancer. While they belong to the same class of drugs and share a similar mechanism of action, they have slight differences in their chemical makeup and mode of action. The choice between Arimidex and Femara should be made on a case-by-case basis, taking into consideration the patient's individual characteristics and preferences. Ultimately, the goal is to provide the most effective and well-tolerated treatment option for each breast cancer patient, ensuring the best possible outcome in the fight against this potentially life-threatening disease.